Gibson Kohli coming to you for Snackable Health. What's going on in polio?
Mike, it's so alarming to see that a disease that I had thought, we had essentially gotten rid of and eradicated has now resurged. And I don't know about you, but in my medical career, I've never actually treated a patient with polio. So it's very alarming to see that it's now come back, and we're seeing not one, but multiple cases in the wastewater. And public health officials are telling us that it's probably been there for several months.
Yeah, I mean, I'm reading that they think there are 100 or hundreds of people walking around with polio in New York, many of them asymptomatic, but there's been at least one symptomatic case, correct?
Yes, there has been. And here's the deal with polio. The majority of patients are actually asymptomatic with that condition. So only about 25% of patients end up having symptoms, and usually flu-like symptoms in the early phases that last for a few days. But where polio is really different from many of the other viruses that cause flu-like symptoms is really the long-term effects that it can have. So there's a subset of people that will progress to have meningitis or inflammation of the lining around the brain and the spinal cord. There's some people that'll actually have paralysis from polio, which is obviously permanent. And then there's also this post polio syndrome that can occur many, many years after you first have that initial, possibly asymptomatic infection that can leave you crippled and unable to really use your arms or legs. And we've all seen pictures of little kids that have recovered from polio and the disability that they're left with.
So, what's the game plan from a public health perspective?
To me, Mike, this is a huge wake up call. And it really says that we need to get our children vaccinated because we have vaccines for polio, 4 doses for kids and 3 doses for adults, that, when given, have a 99% efficacy rate in terms of protecting you against infection. So the fact that this disease is back when it really shouldn't be reflects to me a failure on the part of our parents and even some of our adults to get themselves or their children vaccinated effectively. So I hope that we take this as a wake up call for the rest of us. If we're not vaccinated for polio, we get vaccinated. If we're not completely vaccinated, we should get the booster. And of course, make sure to protect our kids by getting them vaccinated as well.
So, someone like me who got vaccinated way back when, am I at risk? Do I need to get a booster?
It's a great question. So there is some waning of antibodies over time, particularly with this, vaccine. But unless you're particularly high risk for exposure, meaning you're working with the vaccine, with the virus itself, or coming into close contact with someone who's infected, or going to New York and potentially being in a place where contamination of the water could occur, I'm not necessarily sure at this point, given the magnitude of the outbreak, that you need a booster. But if it starts showing up in more cities, then it is certainly a conversation we would be having.
Great. Well, thanks for the update, Pyle, and thanks to all of you for joining us here for this update from Snackable Health.